welcome everyone to this month's episode of our coaching call. I know several of you watch this on replay, so if questions come up after you've reviewed this talk, I want you to, text because, you have access to a text support by phone, or send us a message through the portal, or send us an email because I really want to make sure that we understand this. This is really a question I've had a lot of you ask me, which is really how to optimize sleep in your child who has ADHD. So, and in our membership, we want to make sure you have all the tools and resources. So we're going to be talking about that today. And these are the objectives. But, really delving in, I think it's helpful to look at some data because that's one of the key things we try to make sure we provide you at the Restful Sleep Place, evidence-based information. So we're not just pulling stuff out of the air. What we know is that sleep disturbances are up to 85% of kids with ADHD. 85, that's a large number. And they're actually different sleep disorders that we see in kids with ADHD. Actually, a study actually looked at this and broke it down into about 4 or 5 of them. So insomnia or delayed sleep phase, and I think that's why I put that as one, but they're actually two. Insomnia is a disorder where you're not able to sleep given the right sleep opportunity, while delayed sleep phase is more around what happens when your body clock is on the later side. We see that in a lot of children with ADHD. Also, just generalized sleep difficulties. It's kind of like a mix of things. Sometimes you might have kids who have bedtime resistance or sleep-related anxiety. And then things like sleep apnea, parasomnias, and things like that are also pretty common. So these are things that you want to make sure that whoever is evaluating your child, and if you're the Restful Sleep Place, that is us, we are really looking at this in a lot of detail. So what's the connection? There is a bi-directional relationship. So sleep problems worsen ADHD symptoms, but then ADHD symptoms can affect your sleep quality. And there are different factors. People talk about the dopamine, the circadian rhythm issues, and sleep architecture. And honestly, I'm not going to get you into the weeds about this. Usually I give a talk on this to different scientific programs, and so they want to know the granular detail. The bottom line is your child with ADHD is not just trying to be difficult. They actually have a chemical imbalance that's affecting their ability to sleep. And we know that whether they're not getting enough sleep or the sleep quality is poor, it leads to one big thing, or a few big things: developmental issues, right? Neurocognitive issues, poor academic function, as well as impacts their physical health. And again, these are some common sleep disorders we see in ADHD, and I could tell you we see the entire, array of sleep disorders in children with ADHD. So it's not one or the other. This is something we see very commonly. So let's talk about the impact of poor sleep in ADHD. When you don't get good sleep, it actually worsens the ADHD symptoms. So it leads to this vicious cycle where you have impulsivity, you have poor judgment, we have risk-taking behaviors, worsened attention and concentration, we have emotional dysregulation, as well as various learning problems. And overall, when our kids don't sleep well, right, you're seeing those behavioral challenges, you're seeing more tantrums, more irritability, more mood disorders, weaker immune systems. We're at the season now where people are, a lot of our kids are getting colds and things. When they don't sleep well, they're more likely to be susceptible to even the common cold. They're more likely to have sleep disorders and growth and developmental problems. So the issue with sleep problems in ADHD is that it doesn't just affect your child, it affects the parents. And we've seen an increase in mental stress, in mental health issues, increased stress in the family, strained relationships, impact in physical health, poor quality of life, decreased work productivity, as well as job loss. So this is something we see very commonly. And, the dark blue showing here is just families that think that sleep is very, very important. So you can see most families think it is very, very important, or at least very important. Okay. So we're talking about this because this really does matter. So then how do we start knowing that sleep is important? If kids with ADHD don't sleep well, their ADHD symptoms worsen, and also ADHD worsens sleep symptoms. What do we do? Where do we start from? So it's important to start with a very detailed sleep history. And this will vary based on the main complaint. So your child, you may say, okay, this child is a poor sleeper. This child never sleeps. This child is a restless sleeper. I need to figure out what that means, right? And so we're really asking, is it that they're having difficulties breathing during sleep? Is it that they're having abnormal movements? So a lot of children with ADHD have movement issues too during sleep. Are there abnormal night behavior, sleep terrors, sleepwalking, all those kind of things? So that's really important for us to figure out. And then we want to take a detailed medical as well as social history, right? Of what's the home setting like? Are there other medical conditions? Their sleep environment, their sleep schedule. This is so important because many children don't get enough sleep because, parents or they were not aware that they needed certain amount of sleep. And then you want to assess the impact on behavior, on their daytime behavior. Are they irritable? Are they cranky all the time? What exactly is going on? And that really helps you to then zone in to say, hey, behavior is really out of control and we really need to work on their sleep. Of course, I usually want to do a physical exam, look at the upper airway. Are there big tonsils? Are there small tonsils? Are there kissing tonsils, as you can see in this picture? Are there any symptoms or signs of allergies? Is your child on the heavier side? Because weight can actually impact sleep and cause increased risk of sleep apnea. Is there any neurological factors? Do they have very low tone? Do they have any mental health issues? We take all these into consideration to figure out what's going on. So we've taken a history. This is why your initial appointment, I usually will say you want to save about 60 to 90 minutes, right? It's very comprehensive because we really want to know every little detail. It matters. But maybe we've done that history, we've done that exam. Now the next step is what type of testing should we do? So there are different tests that can be done. The gold standard is what we call the polysomnography or sleep study. So that's really the in-lab study. When I talk about the polysomnogram, it's usually the in-lab study where you come in and they have like the stickers on your head, they have the nasal cannula, you have a pulse ox, you have belts you wear to measure your breathing. And we usually use that to figure out what in the world is going on. So is there a sleep disordered breathing? Is there apneas and things like that? But you can also actually use it to diagnose other disorders. It's not just for sleep apnea. If you have what we call sleep-related movement disorders, again, you have a child who has very restless sleep, we can actually use a sleep study to diagnose that. If you have a child who has maybe seizures or who has abnormal movements during sleep, we can get a sleep study to help us rule that out. Now, as many of you know, getting a in-lab study, and many of you came to see us because you were told it would take, 6 months to a year. It's sometimes not as reflective of your child's real home environment, right? You have a child who's been told to sleep in a lab where it feels weird, it's cold. You have all kinds of stickers on them, and many children might cry, especially the younger ones. And that's really why we offer the home sleep test at the Restful Sleep Place, right? So with that, you can actually measure sleep apnea. You can't use it for other sleep disorders. So it's a case by case basis. I don't recommend the home sleep test for every single child that comes to see me at the Restful Sleep Place, but it's definitely an option for that child who we just want to find out, do they have big tonsils? Do they have sleep apnea? And then we can kind of get the answer we want. Another condition we see frequently is restless leg symptoms. Oh, the other thing I should have said is, we figure out you have sleep apnea. The treatment most of the time is, for a young child, sometimes we have you work with the ear, nose, and throat doctor so they can take those tonsils out. We also work very closely with our dentists, so you can get what we call interceptive orthodontics. So either you get some expansion to just create more room. We don't typically use the oral appliance for children, but the orthodontic strategies are definitely something we work with airway dentists all the time to make sure if you have allergies or other things that are contributing, we want to use that. And CPAP is also an option even for kids. All right, moving right along, we're going to talk about restless leg syndrome. And it's when you have frequent limb movements, usually your lower legs at sleep onset. And I like the acronym URGE. It's really you standing for the urge to move the legs due to unpleasant leg sensations. Rest induces symptoms. Getting active will bring relief. Evening and nighttime make the symptoms worse. They have, as a result of that, they have sleep onset and sleep maintenance problems. And this may co-occur with periodic limb movement disorder, um, and which is a disorder that you see, during the sleep study. About 2% of children have a genetic component to their restless leg symptoms. So I've had patients say, oh yeah, or parents say, oh yeah, I have restless leg syndrome, or his parent or his dad has a restless leg syndrome. So how do we treat it? Usually, this is a point where we usually do our holistic sleep panel because we want to evaluate, are there any nutrient deficiencies? So not just iron, magnesium, vitamin D, all those things can impact the quality of your sleep. And so if you're deficient in any of those nutrients or micronutrients, especially with iron, we'll start you on a supplementation protocol. And then with that, we kind of monitor your symptoms, and typically they get better. And there are also other medications out there that we can use as well if you're still having symptoms after the iron supplementation. Very, very common in children with ADHD. So there's also what we call parasomnias. So these are undesirable behaviors that occur during sleep. Usually you see them during the sleep-wake transitions. So these are kids who have sleepwalking, sleep terrors, head banging, bedwetting actually. Frequently, it's usually at the first half of the night. You have the child doing these very weird, confused, or automatic behaviors, very difficult to awaken during the event, and they do not remember. So we call it amnesia. They do not remember having these events. Typically resolves with age, and usually safety precautions, sleep extension tends to work very, very well. What's sleep extension? Really just adding more sleep. Don't complicate it. 15 minutes extra makes a whole world of difference. And it lets that child settle more into deep sleep instead of waking up with a sleep terror. So now we'll move on to insomnia disorder. That's also another common thing that we see in children with ADHD. We have different types. The behavioral insomnia of childhood, which a lot of the younger kids may have. You have one called limit setting behaviors. You have what we call sleep onset. That's that child that literally needs a sleep crutch or has a sleep crutch where they need you to fall asleep and to stay asleep. Then you also have things like psychophysiologic insomnia, as well as insomnia due to an underlying mental condition. Psychophysiologic insomnia is more common in adolescents, but I also see it a lot in children with ADHD. It's that heightened arousal at bedtime, right? They may get into bed and now they're like, I can't sleep. And they're coming back and forth to your room to say they need help, right? And sometimes things can progress where they start to worry excessively or focus on their sleep issues. Start to say things like, I'll never be able to fall asleep. If I don't fall asleep soon, I'll fail my test, things like that. So all those things are really, really important to pay attention to, because if your child is having these issues, then we need to really see them and help you walk through the issues that are going on. And similarly, a lot of kids may have this fear based in reality. I can't turn my brain off. They have anxiety. They're ruminating at bedtime. They have things like catastrophizing, especially our adolescents. If I can't sleep well, I'm going to fail my test tomorrow, or I never sleep, right? or fortune telling. You'll see, I'm not going to be able to sleep, right? And so these kids are constantly ruminating and catastrophizing about all these things. So these are issues that we kind of walk through with a lot of our sleep therapy tools. Then there's also basic sleep hygiene, right? This is fundamental. And I always say, think about sleep hygiene like dental hygiene, right? You're flossing, you're practicing, healthy eating habits, you're brushing your teeth twice a day. Why? Because you want to prevent disease, right? So those healthy sleep habits will help you on the long run, but may not fix an underlying sleep issue. 60%, some of those things are having a TV in the bedroom or watching TV to fall asleep or being on your phone, or maybe having an inconsistent sleep schedule, taking naps during the day when you're over 5, or drinking caffeine. So really, you want to make sure that you check off these boxes and you make sure that these issues are addressed, because if you don't, it might lead to issues with your sleep overall. And even when we work together, these are basics that we also want to make sure, fundamentals that we want to make sure that we tackle, because otherwise, it's just really going to make things more challenging. How about delayed sleep-wake phase disorder? This is a circadian rhythm disorder. Again, remember I said, and I've talked about this before, your child and your brain produces melatonin in the evening at a certain time. Younger children, the melatonin production starts early, so they fall asleep early. Older kids, there's a delay. Kids with ADHD, there's a delay. So that delay can actually impact the next day where they're sleepy. And at night, they can't really fall asleep until, 10, 11, 12 midnight. And then it's hard to get them out of bed at 7 a.m. for school. And so these issues now become a real true problem, because you now have to wake them up early. At the end of the day, they have very, very little sleep. So I'm going to highlight a few things on how to address the sleep issues. I talked about sleep hygiene already. Some basics are things that you really, really want to work on, because those things can improve, even just falling asleep, it can improve the frequent nighttime wake-ups and can actually improve sleep duration. So what are some of those sleep hygiene rules? The bed is for sleeping, so sleep only in bed. You want to have a consistent sleep schedule, even on the weekends. You want to make sure that your bedtime routine is short, it's sweet, and moving towards the bed. And then you want to make sure that your bedroom environment is sleep promoting. So it's cool, it's dark, it's quiet. Avoid electronics. Usually we'll say about 30 to 60 minutes before bed. And definitely limit caffeine, which can be a stimulant. I like a bedtime chart. A great bedtime chart is something we love. And we can actually have, when we send out this video, we will have the bedtime chart attached. So this is something that you can work with even right now, even with your child, even if your child does not have ADHD. Because when they check that bedtime chart, it helps them engage, they get that positive reinforcement, and it helps improve behavior, and it decreases a lot of the battles that we fight at night. Okay, this is something that, in our insomnia and behavioral coaching program, we talk through this a lot. Sleep onset association, right? It's that child needing the presence of a parent to fall asleep. And I always say this, there's no learning in the middle of the night. And many times families come to see us and they say, well, my child is waking up frequently at night. We don't actually focus on the middle of the night wake ups. We focus at the beginning of the night. So you want to start with bedtime, teach your child to fall asleep independently, and then over time, their night wakings improve, right? So you have different ways to do that, right? You have the cried out method, which you just shut the door, you say goodnight, you see them in the morning. You have the camping out method, which you sit on a chair, and then over time, you move that chair in the direction of the door. And then you can also do the check-in method, which is when you're leaving the room periodically and you only check in, periodically to see how they're doing. So we'll talk about a few bedtime problems. When you have a child who has that sort of bedtime resistance, it's not bedtime. Can I get a hug? Can I get water? I'm sure many of you have experienced this. The bedtime chart is awesome. It's a great place to start. You have it there, you put it on the wall in the bathroom, and you praise them so much as they go through and check off the tasks that they're supposed to do. That's one method. You can also use the timer, which is the set it, blame it method. So the timer says we have 5 minutes, we just have 5 minutes. So you're not the one to blame, it's the timer. And it works very, very well. Um, and then we have the bedtime pass. For a child who has multiple, what we call curtain calls, right? They're asking for the glass to drink, for a hug, to pee again. You could actually have one or two passes. And if they're going to ask for the privilege of getting out of bed, they have to submit those passes, right? And so at night, in the morning, if they keep their passes, you celebrate them. They can trade it in for a treat or something. And then you have the second good night where you have say back good night to your child. You promise them you're going to come back to checking on them, and you come back and checking on them whether they're asleep or not. And that really also makes your child feel confident and comfortable enough to stay in bed. So a few more on the bedtime, wake time problems. I mean, this is really for kids who cannot stay in their bedroom all night. You can use the OK to wake clock, which helps with those early morning wake ups. And the light can change color to let them know that they can get out of bed. Another tool is what we call the sleep fairy, which is a reward system where they get a tangible reward if the goal, the bedtime goal is met. So depending on what that bedtime goal is, you stay in your bed all night long, you don't get out of bed till morning, all those things. And so as long as they meet that goal, the sleep fairy, whose cousins I always say with the tooth fairy, can leave them a treat or a little token. I mean, that's not a long-term strategy. So eventually you're going to have to fade it out. Okay, so talking about bedtime fears, right? You might have a child who's truly scared. They're scared about a monster. They're scared about, this, that, and the other. You could use a monster spray. I would say up until they're about 5 or so. After that, you gotta let them know there's no monster, right? And with that, it's so simple. Don't complicate it, right? Like just pour water, maybe some lavender or something, mix it in a spray bottle and have them engage in that practice. Let's spray the closet, let's spray under the bed. We've gotten rid of all the monsters, right? So that's just something to help. And then I love the flashlight treasure hunt. So you can hide toys around the room and you kind of have them go around either with a flashlight or in the dark to explore and find those toys. And you pair it up with very brave self-statements. I am strong, I am bold, those kind of things. So for those kids who may have, sensory issues, who may feel very tense, who have some sleep-related anxiety, there are a few relaxation strategies that you can definitely implement. So, things like deep breathing, and there's so many apps now. This deep breathing is so powerful. Deep breathing exercises. The apps that can guide them, or they can come up with their own, either some taking a deep breath and blowing out like you're blowing away a cloud or something of that sort. You can also do visual imagery. Imagine yourself at your favorite place, right? Maybe at the beach, and what are you doing? Those kind of things, you can talk them through it. And then progressive muscle relaxation is really about having your child learn to tense and relax their muscles. This is something that could be so powerful. And then even before then, I like us to usually, if you have a child who worries a lot, to have what we call a worry box. And this is a predetermined time for worries, but there's a time limit, right? So that's really something that there's a time limit to it, and they can, kind of figure it out. So with these sensory adaptations and things like that, these are for children who maybe they do have some sensory issues. Using a weighted blanket is great. Usually I would say don't go investing in something that's very, very expensive. Maybe get something from Walmart, Target. Try it first and see how well they do with it, because not every child likes it. And then there's also sensory-friendly PJs, sensory-friendly beddings, and you can find all those online. If they like the noise, the white noise, to mask out any, outside noises, that's really helpful and soothing for some kids. And then just making sure that, the light temperature is all of that is well regulated. The room is cool, the lighting is appropriate, and you rule out any stimulating elements. How about medications? There's so many different medications that are used in ADHD, but you gotta figure out which ones of these medications can be stimulating, right? If they're stimulating, they might actually make sleep worse. You got to figure out what's the dose. So really working with your doctor to figure out the timing, the dose, and then extended versus immediate release. I've had kids start off medications and all of a sudden they're struggling with their sleep. And it turns out that it was because they were on an extended release medication that just kept working up until the time they were supposed to be asleep and they couldn't sleep. Specifically for insomnia, there are no FDA-approved medications for insomnia, but we do use medications, gabapentin, clonidine, guanfacine, to name a few. And then we use melatonin. It's a hormone released by the brain in the evening. It cues the light-dark cycle for sleep, and it's disrupted by blue light. So here's the piece of this. You want to pair these medications and supplements with behavioral strategies. So if I have a child who's falling asleep on their iPad, well, I might give you a boatload of melatonin. It's not going to work. And you really have to be careful about the type of melatonin you're using because many of them are not well regulated. There've been some that actually contain things like CBD and serotonin and things like that. So again, when you're considering melatonin, I know it's over the counter. You could just grab it and try. I think it's important to do it in consultation with a professional. Avoid using electronics up to bedtime, and realize that melatonin does not replace healthy sleep habits, nor does it treat an underlying sleep disorder in typically developing children. So really, really important. We've talked about quite a number of things now about the type of diseases we see, or disorders, sleep disorders we see in ADHD. We've talked about routines. We've talked about treatment for different types, when you should get a sleep study and all of that. So really, that's really what this talk is about, is really to give you sort of a snapshot. I mean, there's variations on this depending on your child and your situation, which is really why we have our clinic visits and all of that to help you craft a plan. But really understanding this, I think it opens our eyes to see that there's so many other issues within that context of ADHD that we need to pay attention to. So I'm going to end now. I mean, there's so many benefits in our sleep program. If you're not taking advantage of it, I definitely want you to do so. We have the same week appointments. We get you in. There's usually never a wait. Direct provider messaging by text or email. We have quarterly guest webinars. We have this monthly group calls. And then we have personalized care plans tailored to your family's needs. It's not a one size fits all. And then we have our premium supplement where you get a discount too. More benefits, right? You have access to all these recordings. We have an insomnia course that's going to be coming up soon. So you're the first to know. You're always the first to know when there's a change, which I think is going to be so powerful and will really be great to use as a resource. Care coordination meetings, pediatric home sleep studies, so many benefits. So make sure that you're taking advantage of them. All right, we're going to wrap up with our supplement of the month, and it's L-theanine. So what is L-theanine? It's naturally found in tea. It helps you feel calm and relaxed without making you drowsy during the day. And so for people who tend to have a lot of mind racing when they try to fall asleep, it's very helpful in reducing the stress hormones, and it kind of keeps your brain in a very peaceful state. So definitely something to consider if you're struggling with sleep. And you can scan this QR code to get access to the purchase and use the 20% off discount. Awesome. All right, so there's also a Facebook group, which is an excellent resource where, again, if you have anything going on, if there's special announcements, you get to be the first to know. We have our, access to all our videos, access to our candid conversations. There's such a wealth of resource there. It's kind of like your one-stop shop for everything that's happening within the practice. And I think that's my last slide. Thanks so much for your attention. If you have any questions at all, please feel free to reach out. We'll see you next month. I know there's a couple of holidays coming up, so we may need to make adjustments to the timing of next month's session. But really looking forward to connecting with you. All right, everyone, until next time, I hope you rest well.